Dear colleagues, I'm Pauline Boucheron, a postdoctoral researcher at the International Agency for Research in Cancer. I'm going to present you findings from the African Breast Cancer Disparities in Outcomes study regarding arm and shoulder problems in breast cancer survivors in sub-Saharan Africa. Breast cancer is the most common cancer in women worldwide. Sub-Saharan Africa is the region where its mortality is highest and sees its incidence increasing. Women affected with breast cancer may experience arm and shoulder problems, which include lymphedema and may impair the quality of life. In high-income countries, treatments such as mastectomy and axillary lymph node dissection, as well as BMI, have been identified as risk factors for the development of an ASP. However, the frequency of ASP related to breast cancer in the sub-Saharan region, as well as their determinants, have been poorly studied. This study therefore aims to fill this gap. The study population was constituted of women from Nigeria, Uganda, Namibia, and Zambia, included in the ABCDO study, a prospective hospital-based cohort of women diagnosed with breast cancer and recruited from 2014 to 2017. These women were interviewed at baseline and then followed up every 3 months using mHealth technology during their whole breast cancer journey. At each 3-month follow-up interview, women were asked if they had experienced pain, stiffness, or swelling in the arm over the past week using a validated questionnaire. Each ASP was considered present on the date of the interview if the woman self-reported an arm symptom of moderate to severe intensity. Potential determinants of ASP studied included sociodemographic characteristics such as age, BMI, socioeconomic position, tumor stage at diagnosis, and treatment characteristics. Follow-up started on the date of diagnosis up to the first reported ASP, date last seen alive, date of death, 4 years of follow-up, or 1st January 2020, whichever came first. We estimated the 4-year cumulative incidence of self-reporting each ASP and identified the determinants using Cox models stratified on study sites, considering death as competing event. On this picture, we can see that about half of the women self-reported at least once a moderate to severe ASP during the 4 years of follow-up. Pain was the most common symptom, followed by stiffness and swelling. Moreover, most often women experience multiple types of ASP over the course of the study. At 4 years of follow-up, 43% of women had self-reported an arm or shoulder pain, while cumulative incidence for arm stiffness and arm or hand swelling were respectively 36% and 23%. The graph on the left shows that more symptoms occurred in the year following the diagnosis of breast cancer, and that cumulative incidence of each ASP varied greatly depending on the country and ethnicity, being lowest in Namibian non-Black women and highest in Ugandan women. This forest plot shows that after stratifying on study site and adjusting on age, BMI, education, tumor stage, and prior treatment, being diagnosed with a higher tumor stage at diagnosis, having a lower level of education, and receiving treatment were risk factors to report an ASP. This study highlights that in sub-Saharan Africa, women with breast cancer are at high risk of developing an ASP that impairs their quality of life. Being diagnosed with late-stage breast cancer was the most important risk factor of self-reporting an ASP. Therefore, downstaging strategies and survivorship care programs are needed to reduce the burden of ASP in this region. Main strengths of this study were its multi-country design, the large sample size, and the use of data collection system that was common to all study sites. However, the hospital-based study population may not be representative of all breast cancer patients in sub-Saharan Africa, as many women with breast cancer may not seek care. Also, outcomes were self-reported and measured every 3 months, and some ASP may have been missed. We acknowledge the ABCDO PIs as well as women who participated in this study and the dedicated team of research assistants. I thank you very much for your attention.